gather here together. I know a lot of people are still coming in, but we will go ahead and get started. I'll give you a quick update, and then Melissa will turn on the chat in just a few minutes so you can ask any of your questions. Let's see here. First, I just want to thank each of you for your support during these incredible times. Hearing from you and validating our partnership is most certainly the best part of my day. And I really appreciate, so many of you who have give comments and shared and asked questions and shared concerns, because all of those things are things we learn from. Keeping learners, families, and staff safe is a huge undertaking. The biggest I know that I've ever had as a human. But I would like to start this meeting and encourage us to take a moment of silence from one of our learners whose father passed away last week from COVID. And it just reminds us what a humbling place that we're in. His name was Justin Vincent, and his family is most certainly in our thoughts and prayers. So let's just take a moment. I'm looking at a picture of him right now that is just him smiling, and it is most certainly something for us to all keep in mind, as this doesn't just have to be about our children, but it is about these extended family members. So some of the area schools are currently considering changing their on-campus learning. I've spoke to some of them over the past few days. I also talked with Dr. Tom Harris, who's the Floyd County Health Commissioner, this morning. Floyd County was nearly at 11% positive last Wednesday and is expected to be higher than that this week. They'll have new numbers this Wednesday. 5 to 10-year-olds are nearly at 14% positivity, and 14 to 18-year-olds are at about 12% positivity as of last Wednesday. Floyd County has continued the mask mandate, so that went into it was in effect until now, at least December 31st, although it is quite certain to be extended from there as well. Indiana's total positivity from the state dashboard is at about 12%, double what it was a few weeks ago. From many accounts, we seem to be in a third wave, and locally, with the state opening to stage 5 a couple of weeks ago and families potentially returning from fall break travel, we anticipate it will only increase over the next few weeks. Although we would like nothing more but to have all of our hybrid learners on campus, it is definitely not the time to add another 100 learners to the building, with the numbers obviously consistently increasing. We'll have another video call around the middle of December to give another update, if not before. The soonest we will consider all hybrid learners coming on campus will be in January. However, I just want to remind, and many of you have been following up on this, many studios still have space for hybrid learners to come on campus starting next week, and we will make some room for some elementary studios to add a few more from their wait list. If your child is on the hybrid schedule and you want them to come on campus sooner, please just email your child's teacher and they will direct you from there. We know that some families are deciding to go off campus at this time. If you'd like to make a formal change to your enrollment from full-time, off-campus, or hybrid, or family support program, please fill out that survey that we've been sending in the cupola notes. CM had flu shots on site the week before break for staff members, and we are having all staff and children and teens stay home with any potential COVID symptoms and for staff until they've been tested. We still only have had that one positive case that first week of school. So we're doing all the right things. I do want to say that we had several learners show up to school yesterday with potential COVID symptoms. We don't know that it's COVID because there's a lot of stomach viruses going on as well. We quickly isolated them and sent them home. Please stay consistent with talking to your child or teen every morning about how they're feeling and taking their temperature at home. Working together will keep our campus open, and that's our goal. So with everyone's hard work, we still have just that one positive, but please know that we are hearing from families almost every day about off-campus learners having positive cases at home. So Melissa will open up the chat now for any questions, but I know that we can do this. We can stay strong. We can be consistent. We can stay home if we're not feeling well. We'll be sending out an email today. It's kind of summarizing this talk, as well as reminding families that we really want them to know what those symptoms look like, so that they can make sure to keep children home. There are increasing places locally. I'm trying to find, if anyone has one, put it in the chat and we'll add this to the email. Dr. Harris thought that there was a place on his website, the Floyd County Health Department, to show the most current testing sites. They recently opened a testing site on Green Valley Road, the actual place where they opened a voting site. So that's interesting. But anyway, just to kind of help families, we have a lot of families that are testing every single week. And many of them are still negative, but we just want to try to help to give you that information as quickly as possible. So I'll let Melissa, and I think Jacob's helping her today, share with us any questions that are coming on in the chat.
Just a clarification that hybrid is not fully starting on the 26th.
Hybrid is not fully starting on the 26th. The soonest the full hybrid program will start will be in January.
A note in the chat that Humana members can request home tests at no cost.
Huh. Okay. Good information. Anything else? Any other questions? Or
I had Jacob all prepared to be jumping on questions from. Oh, here we go.
Okay, right. Yeah. Dr. Valerie Wheat says one source said Clark County positivity was at 15% last week.
I saw that too. Yeah.
Kimberly Wolf says, if we're already on the wait list for a hybrid learner to start early, should we reach out to our child's teacher for an updated status?
Welcome to do that, but we will be following up on all of that. Melissa and I made some plans for that this morning, so but feel free anytime to follow up with the teachers.
Does the school need anything, supplies or donations, from Veronica Combs?
Wow, that's helpful, Veronica. Thank you. I think right now, we just got a shipment of more cloth masks from the state. And so we've been handing some of those out to our families that are on campus now, and we'll save some of those for when other families come on campus as well. So at this point, I think we're doing okay. We are really fortunate that we've been able to keep everyone paid, and whether they're on campus or off campus. And so we've got a little surplus. Our enrollment was a little lower this year than budgeted, but we think that we know that we have some surplus to handle the storm this year. So we're real fortunate in that way. But thank you very much.
Is there any plans to just treat the hybrid kids like full-time off-campus kids? From Denise Romney.
So, Denise, you're welcome to unmute if you have more to that question. Do you mean like just moving them over to that role? Or?
Well, I have so mine's a kindergartner. And so because he's in hybrid, he does go Thursday, Friday now. But for him, this specifically is those younger kids, is that they were having 2 lessons a week at least, but now they only have 1 because they're in class. And I know that they have 2 different programs. They like have their hybrid kids,
Mm-hmm.
and then they have their off-campus program.
Mm-hmm.
So my question is, why are the kids that are hybrid not just treated just like the off-campus, and it's just one thing?
Yeah, I think in full transparency, we have 1 staff member supporting those off-campus learners, and that is a full-time job with a number of off-campus learners at that time. So right now we have several staff members that are supporting adding more to Google Classroom and the lessons for the hybrid and the full-time off-campus learners. So I would most certainly start specifically with your teachers and let them know what you feel like the needs of your child are, and that goes for Denise as well as any families in that situation. What we don't always know, and we have families, and I counsel with them every single week, that want more work, and we have families that want less work. And so the teachers are doing their best to try to find that happy medium and give a consistent level of support, in the juggle. And so each level is kind of doing that a little differently because we're working as teams at each level. So I would, if you feel like your child needs more support or more, ideas for learning, I would go directly there. About moving a few from hybrid to full-time off-campus. But right now, the full-time off-campus number at the early ed is really at the cap. So just to be transparent about that.
Okay, thank you. And I appreciate everything you're doing. I know they're working really hard. I'm just like, they're working on the program. So I'm like, is there
right.
So thank you.
Right, I get it. Thank you. Any other questions, thoughts, suggestions, anything else to share? I really appreciate you all coming online today and, being here as a community with one another. That's one thing we can all control right now. So is to stay in community with each other. So I really appreciate that. Okay, well, Melissa and Jacob and I will stay on here for a few more minutes. And thank you again, and we'll make sure we video call again and around the second week of December, if not before, with an update. And please keep communicating. We really appreciate it. Thanks for giving us feedback to how things are going and what your needs are, and we'll keep moving forward. Take care. Thanks, everybody. Thanks a lot.